Hello everyone, Dikshak here from the team OYG. On behalf of team, I welcome you all on this virtual platform again on another interesting session with Miss, Dr. Kierstin DeWitt, and she will be guiding us on the topic of community acupuncture. Dr. Kierstin is a licensed naturopathic doctor and registered acupuncturist practicing community acupuncture in the Ann Arbor, Michigan, and she also guiding on a NADA protocol and guiding meditation for the addiction rehabilitation facilities. She is also a virtual health coach where she utilizes her knowledge to empower the patients to create a healthier society. Additionally, she is the host and creator of a podcast called ND Inspo, which is a platform for the naturopathic doctors and inspiring students like us. So I welcome you, ma'am, on this virtual platform with us, and thank you for sharing your time and knowledge with us. Now, without the further ado, I would like you to take over.
All right, great. Thank you so much. Yeah, and if you would like to, we can just get started on the slides. I can begin
Sure, ma'am.
teaching all about community acupuncture. All right, great. So as he said, my name is Dr. Kierstin DeWitt. I am, and if you want to go to the next slide, I am a licensed naturopathic doctor, which means that I've done the 4-year naturopathic medical training here in the United States. In the Chicagoland area, I also have a master's degree in acupuncture. And so a lot of what I do here in Michigan is providing acupuncture services to various communities such as Ann Arbor and some Metro Detroit locations as well. And so I wanted to share a little bit about what that looks like because not many people practice in that way. Often we hear a lot about private practice and what that looks like for community or for acupuncture, but the community acupuncture provides a little bit of a different environment and a little bit of a different feel. So I just wanted to share a bit about that. So if you want to, we can move to the next slide. Okay, so what is community acupuncture? So essentially, this is a growing movement where they're trying to make acupuncture more accessible and more affordable by doing it in this community setting. So this is something that has been a way that acupuncture has been provided traditionally. I actually spent 2 weeks in China where I was able to study at an integrative facility at an integrative hospital, and even the way that the hospital is laid out is fairly similar to the community style that we do here in the United States. So the way that we provide acupuncture here typically is in these private rooms and everyone is separated. However, community style is actually a pretty traditional way of providing acupuncture. And so if you want to go to the next slide. So the benefits of the community style is that you get this group setting, and it's funny because when we provide community acupuncture, often people are wondering what is in the air because I am so relaxed, and for many people who have had acupuncture in the past, often it's on this hard table, but the way that we do community style is often in these extremely relaxing recliners, these comfy chairs where they're able to relax into the treatment more. And so sometimes people might take a little nap or they might fall asleep because they're so relaxed. And so they're wondering what is in the air. And really it's just that the environment that we've created is a more relaxing and enjoyable environment. And often people enjoy being surrounded by others that are often that are also in this goal of creating optimal well-being. So there's this ambiance that's created with this group setting. So that's definitely one of the benefits of the community style. But also because it's more affordable. So one of the reasons why we do the community style acupuncture is that we're able to provide it at a lower cost. So for instance, our clinic provides it at a $20 to $40 sliding scale, which allows the person to decide how much they want to pay within that range. And that also means that they're able to get acupuncture more frequently, which is also how it was meant to be used. Acupuncture was meant to be used in series. Rarely has it ever been used as a one and done treatment. It's best used either back to back until improvement has been made, depending on what they're coming in for, or it's meant to be used regularly. Maybe that's once a week, once every other week, again, depending on what they're coming in for. But because we're able to provide it at a more affordable price, people are able to use it in the way that it was meant to be used. And so often we'll hear, I would never be able to try acupuncture if it wasn't for this community acupuncture setting. And so that's a huge benefit. And also because of the way that it is set up, we allow the person's body to determine the length of the treatment, which is also very different compared to private practice acupuncture, where it's usually a set period of time, sometimes maybe 20 minutes or so with the actual needles. And so in this setting, we're able to allow their body to go through their own rhythm with the needles. And so for some people, they might be done quicker. And for others, they might need an hour and a half, maybe even 2 hours with the needles. And that wouldn't be available if we only had private rooms. So again, this group setting allows for this kind of fluid movement with people and allows their own body to enjoy the treatment and to utilize the treatment kind of again as it was designed to be used. So sometimes the treatments are a little bit longer and we're able to do that with the community style. And then the other benefit is that you can set this up pretty much anywhere. So as we mentioned before, I also provide what's called NADA protocol, which is an auricular style of acupuncture where we apply 5 points to each ear. And I'm able to set that up with my addiction rehabilitative patients in just a bare room with a bunch of chairs. I put on some music. I walk us through some breathing techniques and some meditative techniques. And they're able to, again, enjoy the treatment together. And for many people who aren't used to relaxing, being able to see other people relax can be very helpful for that. So a lot of them are surprised that they're able to relax with needles in their ear, which doesn't sound very relaxing, but once they're all in a group setting and they're enjoying it together, they're surprised at how relaxed they actually are. So that is another benefit. And actually, the NADA protocol is used all around the world for various disasters that may occur that can cause a little bit of trauma to the people, such as hurricanes and things of that nature. So they're able to provide these services virtually anywhere. If you have a chair and you have a room, then you can set up community style acupuncture. So that's another reason why I love it, because it's extremely accessible. It doesn't take much to set it up. It can be a very low cost for setup, and it can be very accessible for the community. And so yeah, if you want to go to the next slide. I'm not sure if this will work. It's just a quick video to it's actually to my Instagram. I recorded briefly what our clinic looks like. So I don't know if you want to try it and just see if it goes to the video. If you click that, the community acupuncture. If you
I
click that.
think the video link is not showing here, so
Okay. I thought if you clicked it, it looked like it popped up.
I cannot see anything here.
It looked like if you hovered over that again, if you can hover over it, the community acupuncture part. Yeah, and then click that.
Yep, it's a link. Open the
Oh, okay. Well, that's okay. You can always go to my Instagram. Like I said, I have a little video of what our community acupuncture setting looks like, just to give you an idea, because I am sure it might be a little hard to visualize what that might look like. Or I can hold my phone up to the to the video. I don't know.
Can you see the screen and video right now?
Oh no, is it on?
Yeah, it's on right now. So I think there might be wait. Is it visible?
You mean if I hold? Oh, there we go. Yeah.
I'll just try to play if this. I don't know about sound. It will come or not.
That's okay. The sound isn't important. You can just see what the clinic looks like. So we always have people take their shoes off. And then again, we just have a bunch of recliners. And we also have a couple of tables available, if we want to do cupping or if someone needs a more direct treatment, we do have a couple of tables available. But really all it takes is just a few recliners. We have some tables set up to have the needles accessible to us, to have the sharps container nearby. And that's about all it takes. It really doesn't take a whole lot to set up. So it's pretty simple. You're able to see a lot more patients than what you typically would in a private practice again. So that's another huge benefit, especially for students. So I would definitely try to find a community acupuncture practitioner to shadow, because you're going to see so many different, we see everything. And so the exposure that you'll get to different patients and different cases will be huge. The only difference is we tend to use more distal points. So that means from the elbows down, from the knees down, we'll use the ears and the top of the head pretty frequently. But we still may use abdominal points and back points. It just depends. We just tend to use the distal points more frequently, and people get really great results with that. And again, because they're able to relax more, they tend to see results almost a little quicker because of that. So that is pretty much everything. Again, there's a couple of ways that you can utilize the community style acupuncture. We do it in the clinic, but again, I also go to rehabilitative facilities and provide it for the patients there. So you can travel with it, or you can set up a clinic with it. So there's so many different ways that you can utilize this method, and both are great.
All right, this was the wonderful presentation you got, and we would like to hear you more again if we get time. There are a few questions I get in my mind right now. So you said that the community acupuncture, we can do it in virtually, right? So how the patient responds in that? Because I never tried a community acupuncture on a virtual platform. So is it,
Oh, sorry. No, I mean, I know I should have worded that a little differently. I mean that you can practice it um almost anywhere, as in you can take it,
all right.
you can travel with it, you can as long as you have a room and you have some chairs, then
Yeah.
you can provide, yeah, then you can provide community acupuncture.
Can you share us any experience regarding community acupuncture with us? Because we would like to hear more about that. Any experience or any miracle you got through the community acupuncture?
Okay, so and actually I have found, because so I really really love doing the NADA protocol for the addiction patients, because of the state that they're in. So when they go to the rehab center, they're often going through withdrawals, and they're really trying to kind of reestablish themselves within their body. And so one of the reasons I love acupuncture is because it's a good way to help connect the emotional body to the physical body. And so through using just the 5 points alongside, and one of the other reasons why I love the group setting there is because I'm able to do meditation and the breath work with them, again, to help them get into that deep relaxed state. And so I actually did have one patient there who they had paralysis of their right leg for several years, and so they've always walked with a limp, just kind of dragging their leg. And while we were in the group setting, they were able to move their leg through their own. They were able to have control over their own leg for the first time in in several years. I believe they had a stroke, and they were told that they were never going to fully recover. And so that, and they had tried physical therapy and different things like that, but they had never tried acupuncture before. And I didn't even put points in the leg. I only did the ears. And so I I just hear there's so many times in the group setting like that, with it's the I primarily work at a male facility, and so often these are guys who they think it's kind of silly to relax and and do things like that, but they get so much out of it. and and that experience of him being able to move his leg and seeing him, the emotion that it brought out of him, and also the hope that it provided him in knowing that there are other options, there are other modalities that he can try, that are out there. That was, I mean, many times the people that we see there don't even know that this is an option for them for relief.
Yeah,
Many of them are
exactly.
seeking relief from pain, and that's tends to, that's a big, whether it's emotional pain or physical pain, that they're using these substances to kind of find soothing in. um, they don't know that there's these other options such as acupuncture. And so being able to go to these facilities, provide this, even if it's just for, usually sessions are about 40 minutes or so, being able to teach them, because we're all sitting there together, being able to teach them other modalities such as the breath work and meditation during those sessions, it's just so incredibly powerful. And you're not able to, it's really difficult to kind of simulate that. It's really difficult to have a similar experience. And I also have had meditators in the group who they've been meditating for years, and they've told me they've never been able to get to the level that they were able to on their own like they were with the points and in the group setting.
Wow.
So I think that there's something to the group setting. I think there's something to the needles, and I think that there's something to the breath work and all of those elements that you're able to do with this type of community setting. Otherwise, you can't sit there with someone when they're trying to relax on a table, and it's just not the
Yeah.
same. So I've seen so many, especially at that facility, because I'm able to kind of walk them through something while they're doing the treatment. I've people have been able to communicate or kind of visualize family members that have passed away, and one participant, they said that their grandmother came and told them that they need to get things together, like they need to get their act together, and they were just crying because it's what they needed to hear. And they, because of the quiet that we were able to provide, and because of the stillness that the points kind of create, because we're working a lot on the nervous system and kind of calming the nervous system through acupuncture, they were able to kind of access that through just the stillness and the quietness. So there's so many types of stories, but I think the one that always sticks out to me is the participant who had paralysis of his leg and was able to move his foot on his own. It was just, I couldn't believe it.
It was such a great to see that and from your eyes. I would.
Mhm.
There is one more thing I want to ask you, that even I meditate daily. So on the basis of, sometimes I find myself, my monkey mind I cannot control. So what
Yeah.
would you guide us on the monkey mind technique so that I could control my mind?
Yeah, so and that's another reason why I love being able to sit there and kind of guide them through, because most of the guys that come in there have not meditated before, or they're not used to sitting still. And I find that in the community, in the other clinic as well, a lot of people are not used to just sitting still and relaxing. It's always amazing to me how many people say, I don't know how to relax. And it's often because of that monkey mind that tends to wander, and
Yeah.
especially when we're sitting still, that's when it likes to pop up, right? So often what I have people do, and I actually walk them through this kind of 3-part series. And so I always start with this breathing technique, and you might know the name for it. I don't know the name for it, but essentially you're breathing in and quickly 2 times through the nose and 1 long
Yeah.
exhale through the mouth. And it usually just takes a few rounds. We just do a few rounds of that to kind of help bring the nervous system down, and it gives them something to focus on. You kind of have to think about, okay, two breaths in through the nose, 1 long breath out through the mouth. And then what I have them do is kind of bring their mind to their body, and I'll walk them through, okay, let's focus on the feet, and then do the muscle relaxation technique where you're contracting the muscles and then you're relaxing again. So this is kind of, it's a way of connecting the mind to the body, but you're utilizing the mind in some way. So it's giving you something to focus on. And it's also bringing you back into your body, and allowing yourself to relax and just kind of tune in. So that's the second part. And then the last part I do is the belly breathing, which I find so many people can benefit from, because you're activating the vagus nerve and the phrenic nerve, and so you're helping to balance the nervous system. You're also strengthening your core. We tend to become chest breathers over time, and we forget how to use our belly to breathe, and that can cause some instability with our back. And so a lot of people benefit from it from a structural point of view as well, just allowing to relax this area and to kind of bring it to the belly. And then through that, it's again another way to kind of focus the mind on an activity that is relaxing the body. So when I think of meditation, I don't always think of it as, okay, let me just sit here and be still. Meditation can look different for so many people. It's really just about it's really just about focus, right? And so if you're
Yeah.
able to apply that focus whatever way works for you, um, so I think breathing is one of those strong ways of doing that, of just kind of
Yeah.
bringing the mind to something that is, repetitive, and it's
Yeah,
not
it
something
helps
that
to relax as well.
exactly. And so usually either the belly breathing technique where they're kind of focusing on, the air coming in through the
Mhm.
nose, filling the belly, feeling what that feels like to fully expand, and then allowing it to usually by that point I'll have them close their mouth and breathe in and out through the nose, and just feeling what that air feels like to flow through. So really just focusing on each kind of component of that, of what does the air feel like, what does my body feel like, this sort of thing. So that again, you're kind of focusing the mind, you're bringing it to yourself, you're bringing it to your body, you're bringing it to this present moment. And that tends to help people allow themselves to relax, because they're not focusing on, well, what's going on up
Going in the
here. They're
mind.
focusing on,
Yeah.
yeah, they're focusing on what's going on down here. And so then, once I let them kind of get into that and they're in a more relaxed state, then I'll check in every now and then and see where the monkey mind is at. And I'll have them scan their body. Okay, what's tightened back up? Just kind of rechecking in, um, a head to toe scan. Okay, now let's do a couple belly breaths to kind of let that go. And then if they're having a really hard time, then I'll have them count. I'll have them do either the box breathing or just some type of breath work with the counting. You're counting in as you inhale, you're counting as you hold, you're counting as you exhale. Again, to bring the mind kind of back.
Yeah, it's mindfulness. Yeah.
Yeah, yeah. So, and then the other way, during the more quiet parts of the meditation, is I'll just have them ask themselves, is this thought helpful or hurtful? And if it's hurtful, then you can just let it go. If it's helpful, then maybe it's something
You
you
should
want to
continue.
meditate on.
Yeah.
Yeah. So to me, that's a good way of kind of acknowledging those thoughts that come and go, because that's what our mind does. Our mind thinks,
Yeah,
it's
it's
a helpful
continuously
component.
and looping.
Yeah, we need that function of our mind. It's not that we want to completely shut off thinking. That wouldn't be good for us either, right? But we
Yeah,
want
that
to
we
be able
cannot do
to
even.
yeah, but we want to be aware of what we're thinking, and we want to have some kind of control over that element.
Yeah,
And I
I
think
feel
that's
meditation is a kind of a scanner that you can scan your thoughts and then you can just go further in it.
exactly, yeah. So just that simple prompt of, is this helpful or is this hurtful? And then again, if it's hurtful, you can just let it go. And if it's helpful, then you can go further into it. So that's usually how, especially because most of the people that I see are new to it. And so I start, these are like simple things that you can do that are pretty easy to understand. But of course, you can take meditation pretty deep.
Sometimes, I myself, I find that if I'm in a meditative state, I go deep and I don't know the time, where the time is.
Yeah. Yep.
So
And that's
sometimes
what you
that
find
happens.
with Yeah, and that's what you find with the community acupuncture in both settings. Often people are so surprised at
Yeah.
how quickly time goes by when they're in a relaxed state. Another reason why I love um, them being able to recline in this nice comfortable chair and to relax is because, again, most people are not used to just allowing themselves to relax, and they're just so surprised at, and that can be a form of meditation, of just allowing your body to relax. Um, and and that in itself can be so beneficial, just allowing your nervous
Yeah.
system to calm down.
Uh, One thing I wanted to know that how you gain interest in the naturopathy. That in your starting days, what made you think that naturopathy is a particular good subject to go on and further?
Yeah, so I started out, my undergrad was in dietetics, so the study of different diet therapies. And as I was getting close to graduating, I realized that there was still so much to learn. There was still kind
Yeah.
of this gap between, I understood they gave us all the formulas of like the perfect diet for people and, with different ailments, different diseases, but there was still kind of this disconnect for me. And I just felt like there was still so much more to learn. And so I was looking into other further education for when I for when I was to graduate, and I came across naturopathic medicine, and I had personally never heard of naturopathic medicine before that. But it came up because I was looking for different nutrition programs, like a master's in nutrition or a doctorate in nutrition. And so the naturopathic medical program popped up. I looked at the philosophy, and it resonated with my understanding of food as medicine, and just my understanding of the impact that you can have when you actually treat the root cause. Because even what I was seeing with dietetics was often we were kind of working around the prescriptions and the pharmaceuticals that were already provided by their medical doctor. And to me, it didn't quite make sense, because my training told me that, well, this disease can essentially reverse just through dietary changes. And yet we're trying to manipulate it around these pharmaceuticals that were done first. So to me, it just seemed kind of opposite of what made sense to me. And so when I learned about the philosophy of naturopathic medicine, which is root cause, treat
Yeah.
the root cause, and then also it's about the least invasive first. You start with the least invasive thing, and the most effective. You want it to be effective but also least invasive, and then you work your way up as needed, right? So we still learn pharmaceuticals, we still learn minor surgery, but it's just about when is that necessary versus when can we start from the more essentials, or the fundamentals, and and work our way up. So when I learned about the philosophy, it resonated, and I said, that's what I'm doing. Like, this is my calling. This is what I'm supposed to be doing. And then when I was in school, because here in the United States, not all schools integrate acupuncture. Most of them are still a separate program. I shouldn't say most, but about half of them are a separate program. So some of them learn, because I know that there's many schools in India where it's integrated in, acupuncture is taught with naturopathic medicine. And so here it's usually a separate program. So I went on a medical brigade to a clinic in Nicaragua, and they had students from other schools there who were using acupuncture. And I saw how I just remember this one younger girl, she had pain in her back for essentially her whole life. They applied maybe 3 needles, had her stand up and walk around, and she started crying because it was the first time that she didn't have pain. And
Wow.
I was blown away, and I said, I am going to learn this when I get back. Like, I am going to go and add this, because at our school, you can do what we call dual degreeing, where you can add another degree. And so after you've so the naturopathic program is the four-year
Yeah.
program, and then the acupuncture program is usually about a 3 to 4 year program, just depending on how quickly you go through it. And so as soon as I was allowed to add it to my other degree, I did, because after seeing that, I just knew for more quick relief, because as you know, naturopathic medicine can take some time. It can take some time to kind of apply the different modalities and to see some of those results, especially for things like chronic pain. And so I knew that acupuncture would be just such a great therapy to have to help provide some alleviation quicker. And that's what I've found so far. So I'm very grateful to naturopathic medicine and to acupuncture as well.
Yeah, acupuncture is a very technique that can give you relief in instance. So I think just like in allopathic medicine, you have the emergency ward. Acupuncture works as emergency ward in naturopathy. That's my particular view. So
Yes, it can definitely be helpful for those more acute stages. Mhm.
yeah. One last question from my side. Do you have anything tips or suggestions for the us aspiring doctors that what we should be taken care of being a doctor and how should we go further in future as a naturopathic doctor?
And do you mean kind of like self-care practices, or um, what do you?
I think it's both because we right now don't know that what future will bring us. So
Mm, right.
the
Okay.
one thing
So
is that we need to serve the patient. So that is what the main base for the naturopathic doctors right now.
can you repeat that?
Yeah, our base is to serve the patients as much as we can. So regarding to that,
Okay. So um, really, I think one of the most helpful things is just to stay curious. So allowing yourself to stay curious so that you can continue to learn,
learn.
because it's easy to feel overwhelmed or to get burned out. But if you kind of maintain this curiosity of, oh, I wonder what this modality does, or oh, I wonder, about this type of ailment, and just spin it in a way of curiosity versus, oh, I have to study this or I have to learn about this. um, if you spin it in a way of, you're curious about this, or I want to learn more about this, and with the understanding that someday you're going to be the person who is helping someone with that, I think that it can really help kind of maintain that motivation that you need as an aspiring naturopathic doctor, because it's a lifelong learning, and you don't want to burn yourself out and get overwhelmed, but just think about it as this, allowing your curiosity to kind of fuel you and to kind of keep you going, because that's what I love about this medicine is it's so fascinating, and there's so many different ways of utilizing it, and we have so many tools. And so to me, you can't really get bored of it because there's
Yeah,
always
that's so
something to
many.
learn. Yeah, and so I would just really try to um, maintain that curiosity, and then also just take care of yourself, and be kind to yourself during the process, because again, it can be a lot. There's we're learning a ton of material, and we want to help everyone, right? So just being kind to yourself, and being compassionate with yourself, of I'm human too, and I need rest, and I need water, and I need those nourishments that I teach my patients too. So allowing yourself to rest, and to move your body and do all those things that we know are good for our patients, but sometimes we forget that, oh, I'm human too, I need those nourishments as well. So yeah, so stay curious and be compassionate to yourself, I would say.
Thank you so much, ma'am, for your lovely time and this is lovely presentation we got. We would love to hear you more in the future if we get a time and connect virtually again. So thank you so much for your time and knowledge you shared with us.
And thank you all. Thank you so much for this opportunity. And I'm looking forward to seeing where, your future takes you.
Yes, ma'am. Thank you. Thank you for your good wishes.
All right. Well, you all enjoy your evening.